Excellencies, distinguished delegates, colleagues, first of all, let me thank the countries of Egypt, Uganda, Malaysia, and Brazil for their leadership to eliminate hepatitis. In the Philippines, hepatitis remains a persistent public health challenge. 1 in 10 Filipinos lives with chronic hepatitis B, and with less common, the hepatitis C continues to affect thousands. These infections are among the leading causes of liver cirrhosis and cancer, disproportionately affecting rural and disadvantaged areas and different islands. A national seroprevalence study showed that the prevalence was 16.7%, which estimates to about 7.3 million Filipinos. In 1989, our National Hepatitis Control Program has expanded progressively from the introduction of the infant hepatitis B immunization and blood safety protocols to scale up to the scale of hepatitis B vaccinations within 24 hours of birth, now a core part of our national immunization program. Coverage rates, however, remain uneven, especially in geographically isolated and disadvantaged areas. Through the Universal Health Coverage Act of 2019, the Philippines is integrating hepatitis services into primary health care. This includes risk-based screening, confirmatory diagnostics, and treatment pathways. Yet, gaps persist. Limited laboratory capacity for testing for hepatitis C, RNA testing, the high cost of direct-acting antivirals, weak linkage to care systems, and stigma that deters people from seeking these services. 2 provinces, Bataan and Pampanga, actually included testing in their primary care. To accelerate elimination, the Philippines must strengthen its response by scaling up population-based surveillance and registries to generate robust, disaggregated data for program planning and development and resource allocation, ensuring equitable access to diagnostics and medicines by negotiating lower prices, exploring pooled procurement, and leveraging on global financing mechanisms, expanding task shifting and the training of health workforce so that hepatitis prevention, testing, and treatment are fully embedded in primary care. Addressing service delivery inequities in rural, indigenous, and migrant populations, including integrating hepatitis interventions into maternal and child health, HIV, and TB control programs, and institutionalizing monitoring and evaluation within the UHC framework to measure progress against the WHO 2030 elimination targets. Recently, our National Health Insurance Program included hepatitis testing in the financing for the program called YACAP, or a Primary Care Benefit Package. The Philippines has long championed. We cannot do all of this alone, and the Philippines belongs to the ASEAN and the Western Pacific region, where hepatitis B is highly prevalent. Our engagement here today is a call to deepen regional cooperation, share innovation, such as the scalable models and testing and treatment, and advance South-South collaboration to close equity gaps, and particularly for vulnerable groups and marginalized groups. Take note that we also have assistance from our partners from Harvard through the STITCH program, both in Vietnam and the Philippines. The Philippines has long championed for health diplomacy in the United Nations on migrant health, on disaster preparedness, and universal health coverage. We bring the same conviction to hepatitis. To accelerate elimination, we strongly support the call for a dedicated UN high-level meeting on hepatitis. Such a meeting would provide the political momentum, the partnerships, and the resources needed to deliver on our shared commitment to eliminate hepatitis as a public health threat by 2030. The Philippines stands ready to work with all of you, our new friends, to make this goal a reality. Thank you.
Thank you.